today's high-volume pharmacy automation technologies, fill prescriptions with extraordinary speed and unparalleled accuracy. Let's work together to unleash the full potential of pharmacy.
Welcome to Watch DSN, Drugstore News' series of interviews with retail pharmacy leaders that are transforming their retail pharmacies into healthcare delivery destinations. I'm John Kenlon, Senior Vice President at EnsembleIQ and publisher of Drugstore News. Today, we're pleased to have with us Dain Rusk, Vice President of Pharmacy at Publix. Headquartered in Lakeland, Florida, and in business since 1930, Publix has almost 1,300 doors in 7 and is in the top 10 supermarkets by revenue in the U.S. Publix is also the largest employee-owned company in the U.S. At Publix, the mission is to be focused on customer value, sustainable, dedicated to its employees, devoted to its shareholders, and a responsible citizen of the communities in which it does business. So Dain, you've done a couple of these with us before, including several issue summits. Are you ready to get started?
I'm ready, John.
Excellent. So first question, Publix invested in a large capacity central fill facility in Orlando, Florida recently. Talk a little bit about that and how central fill improves workflow and benefits the patient.
Sure. So we've had our central fill facility now for a couple of years, and to be quite honest, for us, it was really about trying to find efficiencies in our store. But what we really learned along the way was beyond those efficiencies, there was really a tremendous opportunity to pull a lot of production out of our store, which consequently was going to really lead to freeing up our pharmacist times and be so much more customer facing. So in our world, really what we started to do, or what we started to see, was as we scaled this out across a large portion of our organization, was we were able to take a lot of the day-to-day, what I'll call refills, and a lot of that production that really capitalized or monopolized, is a better term, both our pharmacists and our technicians' time. So we take a look at a lot of our maintenance refills. We've got a large medication synchronization program, as well as refill reminder program. We're able to look at those prescriptions several days out, have those filled remotely, send them back to the store completely ready, prepared to go into our will call bin to be dispensed to customers. So it really not only improves efficiencies, it improves capital investments in inventory that needs to be maintained in every store. But along the way, what it's really done is it's pulled out 30-40% of the actual prescriptions being filled daily. And as we think about the times we live in today, where having the pharmacist be more accessible as a healthcare provider, it's so important having that large central fill facility to be able to do that.
So you have increased capacity, and that allows you to do more. So Publix is now partnering with big health systems in Florida and in South Carolina. What's the benefit to the hospitals and their patient population? And talk a little bit about the Meds to Beds program.
Sure. So in terms of partnering with the hospitals, first and foremost, what it allows us to do from a pharmacy standpoint, it allows us to bring our expert capabilities into that hospital. A lot of times for the hospital, having this outpatient retail pharmacy just ends up being a burden and expense for them. We're able to come in, provide our expertise, and be able to service that hospital from an outpatient standpoint. But as you said, from a meds to bed standpoint, that's probably our most important feature that we bring to the hospital, and that is the ability to see the patient at bedside and provide them discharge medications. Because from the hospital standpoint, what we're able to help the hospital do is really dramatically decrease those 30-day readmissions. And that's so important for them when they're measuring things like HEDIS scores and what those reimbursements are going to look like from CMS in terms of Medicare. So when we can help drive down readmission rates by 40% just by getting that prescription in the patient's hands when they leave and preventing any delay upon discharge, it makes a big difference. I'll also tell you there's a secondary part too. When you think about it, you also have a portion of the population that's post-operative in the hospital and they're leaving. They're not as mobile. They're certainly not all that interested in going to a pharmacy. They want to go home. So that convenience alone leads to a very positive customer experience, not only for the hospital, for the patient that's in there, but also from the standpoint of the discharge from Publix pharmacy. We're seeing regularly on these discharges a number of patients who may not necessarily be a Publix pharmacy customer, but that experience and our follow-up upon that discharge, we follow up with them on 30 days to make sure things are going well, to see if they need any refills, oftentimes leads to us generating new patients that want to come and sign up with Publix pharmacy for the first time outside of their discharge medications.
You're in the right place at the right time. You mentioned you're dramatically driving down the readmissions rates, so you're making the payers very happy.
Yeah, so we know what we're doing is being a big part in the, what I'll say is removing costs from the healthcare system. We know that there's just tremendous amount of wasted costs, whether it be in multiple areas, but this is certainly one area where patients who are delayed in getting their medications and starting that upon discharge, that may lead to a further exacerbation of the whole event they were just discharged from the hospital for. So we know by preventing that rehospitalization, that readmission, that the cost that we're helping take out of the system is something that is, it's very measurable and it's very impactful.
Yeah, everybody wins. That's great. Well, it wouldn't be 2021 if we didn't talk about COVID and we didn't talk about telehealth. Telehealth has exploded during COVID. What have your telehealth partnerships meant to Publix, its patients, and how does telehealth fit in with the physical store? And I want to add to that, is there a role for the product suppliers, service providers, well, I guess more really product suppliers when it comes to telehealth, and should they be detailing, can they detail those who deliver care, whether it's a doctor or a nurse practitioner or a nutritionist? Sorry, long question, but
yeah, and I mean it's kind of twofold. Sure, it's a twofold question for us because we were in telehealth, we were in that space even before COVID came about. Certainly, COVID accelerated that, made it much more relevant, much more prominent. But as we talked about previously, our hospital partnerships, that's a very big issue. That's a very big partner with them, is having this extension of their healthcare system inside of our stores. It's the idea of bringing healthcare to the consumer versus the consumer having to go to healthcare. So we've been partnering with different healthcare systems over the past several years, different hospital systems that we're partnered with today. I want to tell you, we have over 37 different telehealth locations, and we continue to expound on them or expand on them where it makes sense. Certainly, when we first got into this space, it was a twofold thing. It was the idea of, from the healthcare provider standpoint, there are so many patients that just do not have a primary care physician, and oftentimes when some sort of event occurs, these same patients are ending up in the urgent care. They're ending up in the emergency room. It's just adding a lot of costs, as we talked about before. So these partnerships with the hospital system is bringing costs out. So by creating a telehealth environment where things like, people who are having a respiratory infection or maybe some sort of eye infection like pink eye, things that can very easily be diagnosed as well as provide a care plan remotely. These were things that we were partnering with them early on. And as I said, a big part of our philosophy and strategy in the beginning was bringing healthcare to the consumer. Well, certainly then COVID comes about, and the idea of not only people sheltering at home, but having more of a contactless type experience really accelerated COVID for sure. Accelerated telehealth even more. Mm-hmm. What I would say COVID did from a telehealth standpoint is it really started to make payers take notice of this and actually reimburse for it. Prior to that, this was really a fee-for-service type market. And for a lot of people, they were willing to pay that fee-for-service. It wasn't terribly expensive, and it was better than having to wait several hours, as I said, in an urgent care and emergency room, or not being able to get an appointment at their physician's office. But now, I think what we're starting to see is more and more payers, certainly Medicare and in that space first, CMS, and then you have many commercial payers that have since followed suit. So many patients now for their regular copay can actually have that. Again, we've got kiosks within our stores. Those are important to us because there's different acuity of care. You certainly can do telehealth right on your telephone, and there are many instances where that's very sufficient. But within our kiosks, we have different peripherals that can be accessed remotely, and it can give a more just a more detailed visit, such as being able to take blood pressure, being able to listen to heart rate, being able to look in your ears, being able to, so using an otoscope. So those peripherals allow for an even more expansive type telehealth visit. So we know there's, and we promote both. We certainly have the telehealth visits where they're using their mobile app, their mobile device, whether it be their phone, their iPad, or even their computer. But certainly within our clinics, we can get a little bit deeper. We can diagnose a few more things. And again, I think what COVID did was it accelerated payers to look at this area, this space, a little differently than they had in the past. It wasn't something they were quick to want to reimburse for. But I think what we've started to see is it's really opened the doors, and we're starting to see more and more healthcare systems adopt this approach because of the reimbursement. And I think really what it did was patients who maybe were a little hesitant before about not actually seeing a physician face-to-face, or nurse practitioner, or any practitioner for that matter, have become much more inclined with this. They've realized the world around them changed almost overnight, and they became much more receptive and adoptive of this type of this technology.
So it's not going back to the way it was. And just like some folks like to buy online or shop in a store, or buy online and pick up in a store, we're going to have a different approach, and it's going to stick.
Yeah, I think so. I think what you certainly saw in less than a year's time was telehealth probably quadrupled in terms of patient visits. So what you now have is really good concrete data to study and show the value of it, as well as the decrease in cost. Because again, I think that's really what it's going to come back to as we continue to talk about these different partnerships, is how do we take cost out of this very expensive model that exists today? So many people that continue to enter into this space, it's about disrupting it, but they're disrupting it because it's a very expensive, a very antiquated type model.
Okay. Changing gears here a second. We've heard a lot about specialty pharmacy over the years. It looks like it's really arrived. It's more important than ever. What does it mean to Publix customers, and how should suppliers think about it and play a role?
Sure. So certainly from our standpoint and from our customer standpoint, being in the specialty space, having a closed door specialty pharmacy where you're able to provide those limited distribution drugs, as well as those what I'll call back-end services, benefits investigation, copay assistance, what have you, those types of services. From our standpoint, it enables us to provide that full concierge experience. What we want to be able to do is allow our patients to come in, not only get their regular prescriptions, but their specialty medications, their compounded prescriptions. If they have to come to us for their retail or their regular maintenance drugs, but then they have to go to some other specialty pharmacy, that's not a great experience. And frankly, from a business standpoint, we stand to lose them to someone who can provide that one-stop shop. So for us, it's extremely important that we're in that space, being able to provide those medications, access to those medications to our patients, so that we can provide that full concierge experience. From a supplier, from a manufacturer standpoint, from our standpoint, it's very important that they, one, understand, when I think of Publix, that they understand that we do have a fully closed door specialty pharmacy that's fully accredited, and most importantly, understand that we can provide all these services. When it comes to limited distribution drugs, we want to make sure that we can have access to these drugs. And when we can't, it's important that our suppliers and different partners out there are, as for example, detail and physicians' offices, they're making them aware who has access to those drugs, because the experience becomes a very challenging experience when the patient shows up to your pharmacy only to find out they have to go somewhere else, and you have to help them navigate that journey. It's a frustrating experience. Specialty drugs are not always that easy, and they're not always that accessible. So, helping us gain access, ensuring or giving them the opportunity to come see that we have all the accreditations and all the things that make our specialty pharmacy the same as every other closed door specialty pharmacy, I think is important for them to know. But where we don't have access, it's so important that manufacturers, for example, when they have their detailers out there talking to physicians' offices, it's so important that they understand where that access can be had, because this is a challenging space for the average consumer to navigate, and providing access and ensuring that they know how to get that access is so important.
All right. So access, convenience, affordability, accreditation. Those are some of the key
absolutely.
buzzwords.
Very important pieces.
Yep. Excellent. Going back to COVID again for a moment, what were some of the most effective things that Publix did in response to the pandemic? And what do these moves tell us about retail pharmacy's capabilities and their role as a healthcare provider in the future?
So, what I'd say one of the most effective things we did was actually something that happened in past tense and something we talked about in the beginning. And that was, we made a significant investment several years ago in a central fill facility. And we were at a point where it was very mature. We were able to create significant efficiencies within our store. And the reason I mention that and bring that up again is because we were able to hit the ground running early in January, and really be part of what I'll call the solution of giving people shots of hope in their arm. Early on, all the pharmacies that we were able to participate, we're now at a point where all of our pharmacies are. But in the first week in January, we were early on giving COVID vaccinations to senior population in the state of Florida, and grew that pilot program into across our entire footprint to where we were doing that in Florida, in Georgia, in South Carolina, in Virginia, in just many other states. But what I would tell you is, when you look at Florida, for example, where the senior population certainly over indexes, and early on for the first 30 to 60 days, the eligible population beyond healthcare providers and long-term care residents was the senior population, 65 and older. We were in a unique position to where our stores were able to stand up a solution in store, create this convenience for seniors. As you started to watch some of these things that were unfolding on the news, where seniors were camping out for days on end, waiting, trying to get a very limited supply of shots at some of these clinics that were being set up by departments of health, or even the limited supply that some of the hospitals have. It was a frustrating experience for people. We were able to create a digital reservation system early on. Certainly there were challenges because supply didn't meet demand, but certainly anyone who went through that experience, I think, would tell you it was a wonderful experience, the people who were able to get appointments. But we were only able to provide that because we made significant investments in technology several years ago that allowed us to have efficiencies at store level, that we could provide that really wonderful experience to give people vaccinations, versus creating these. And there's nothing wrong with this. All these approaches work, but when you're trying to create these stand-up clinics or these hub and spoke models, they're great. But what you're doing is inviting a lot of people to come to those areas. Becomes difficult to really practice social distancing and some of the other things where we could work it in the workflow in our pharmacies. We were able to really kind of maintain all the proper social distancing, all the things that the CDC really recommended, and still provide this wonderful experience of getting shots in arms.
Wow, that was quite an undertaking. Thank you. Last question. Publix invests heavily in the communities in which it does business. Housing and shelter programs are a big part of that. Why does Publix do that? And what does it just say about retail pharmacy's ability to be more than just a corner drugstore?
From Publix standpoint, I can tell you this is part of our culture. This isn't something because we're in a pandemic and we want to stand out from the crowd. Our founder, who's fondly known here internally as Mr. George Jenkins, many years ago, as you said in your opening, John, one of the largest employee-owned company in the United States, he gave back to the employees and to his communities that we operated in. And that has been foundational to Publix from the first day that we opened up our first store in Winter Haven to stores we open up today. So when it becomes part of your DNA, it's part of your fabric at Publix. Giving back is just what we do. We hire, what I would tell you is we hire servant leaders. That's what we do. People who think more about the consumers that we are able to provide for, and whether that's through groceries, whether that's through healthcare and pharmacy, than we do ourselves. So, I think this is as I said, I think it's foundational to who Publix is and what we're about. On a yearly basis, we're getting out there as employees into our communities and providing back service days. And then that just expounds into these opportunities that we have where we can donate into shelters or into food banks during the COVID pandemic that we had, where many of our farmers were struggling. We were able to buy up those products and provide them to struggling families through food banks. So again, this isn't something, when you look, as I said, in the pandemic, you can go back and see from when our company was founded all the way through until today in 2021. It's what Publix is about. It's foundational to what we believe in and what we stand for.
Yeah, you've been doing it since 1930, coming up on a 100-year anniversary.
Exactly right.
Yeah, I guess something's working, right?
Yeah, I think so. I think you'll find a lot of proud owners here who believe in giving back to their community.
Yeah, that's terrific. So thank you. What I heard was having capacity, ramp up speed, convenience, taking cost out of the system, making it affordable, telehealth, efficiency of workflow, and of course, community, giving back to the towns and the cities in which you do business. Thank you so much.
Absolutely. And just to piggyback on that last comment you made, giving back, that's exactly how we look at being part of this solution of giving COVID vaccination. We want to be part of that, part of our communities where we're able to provide them those shots of hope, as I like to call it. So many people we've had a chance to interact with since we started doing this who have been sheltered at home for the entire year. And just the freedom that this has given them to go out and see loved ones and give them a hug once again. It goes back to giving back to our community. It's so important to us here at Publix.
Dain Rusk, VP of Pharmacy at Publix. Thank you so much for sharing all of that with us. We really appreciate it. Be
John,
well.
Appreciate your time. Thank you.
Good deal. See you.
Take care.
Bye now.